for one of the larger employers in the northwest part of Oregon. I have been involved in universal care, or been interested in it, for about 10 years. And as an outgrowth of that, last summer I decided to commission a poll. And it's not the first poll that's been conducted on universal care, but it is, to my knowledge, the very first poll that features almost in concentrates on funding of universal care. I'm grateful to Ron Lowe of Woodcastle Furniture in Oregon, who helped with the financial contribution to the polling effort. Though it's not important to the discussion, we both happen to be registered Republicans in rural Republican districts. After doing a search, after evaluating a number of very capable polling firms, Stuart Elway of Elway Research, Seattle, Washington, was selected based on national reputation, rated one of the top 6 pollsters in the country by Nate Silver, and the proposed methodology. The poll was completed in July 2019 with an error margin of plus or minus 5%. Oregon voters were contacted at random via landline or cell phone. Half of the cell phone respondents completed the survey online. This is to see if there is any bias between talking to a real person and trying to give them the answer they want, or just talking to a computer. And in this case, there was no apparent bias. You may note that in Oregon, there are more voters who are registered with so-called third parties or are unaffiliated than there are members of either regular party. The problem solving, working closely with Stuart Elway, the poll was designed as a problem solving exercise. Is there a problem with healthcare, and if so, what is it? Is universal care a desirable response to the problem? And third, would you be willing to vote for a tax to create universal health care in Oregon? The poll begins by asking people how they would rate the healthcare system, including how we pay it, how we pay for it. All poll results are given in percentages. About half say that the current system is unsatisfactory or poor. This is a very low rating for something so fundamental to our society. But do they agree on the problem? When poll respondents were asked various questions about cost, complexity, access, quality, the association of healthcare with employment, 81% identified the increasing cost to individuals, governments, and businesses as the most major problem. 81% is about as unanimous as voters get. They also identified other major problems, including access, billing complexity, bankruptcy, which are indirectly associated with the increasing cost of healthcare. When asked if universal healthcare is a desirable solution, 75% said that universal healthcare is a desirable solution to the problems that they had identified. Now, after several more questions, we got down to the nitty-gritty of would they actually vote for a measure that would raise a lot of money through tax. So poll respondents were asked about a hypothetical ballot measure to create a universal healthcare system in Oregon. Wording is important, so I will now read the question as it was presented to the poll respondents. I'm going to describe a proposal that could be placed on the ballot. It would establish full lifetime healthcare, including vision, dental, and hearing for every person in Oregon. Under this plan, you would pay no direct medical costs, that is, no private insurance premiums, co-pays, or deductibles. Instead, you would pay a new healthcare tax, and a state agency would pay all medical costs. So, and somewhat surprisingly, 66% show support for a new healthcare tax paid to a state agency. Now, a common technique in polling is to ask a question, test the response, provide more details, and then test the response again. It was assumed in designing this poll that once they were told the magnitude of the tax, the support would go down, like some national polls where they say, do you want universal care? Maybe get numbers in the high 50s or mid 60 percentages, and then say, do you want to pay a tax increase? And support goes down into the 30s. So here we've already asked about the tax and got 66%, very high support. But now we're going to ask another question that gives them the magnitude of the tax, but also gives them some reassurance. So this question says that the tax would be 2 to 3 times the amount of money that the whole state of Oregon runs on, but also gives them assurances that a typical household would pay less in tax than they do currently in premiums and out-of-pocket expenses, and also provides some assurances that employers would continue to pay about as they do now. With adjustment for rounding, 62% of poll respondents answered that they would definitely or probably vote for such a proposal. This was quite a lot higher than expected. And somewhat unexpectedly, it actually got fairly unusually high support in both Republican and Democratic regions. So here we've got 5 congressional districts in Oregon. The majority support for healthcare tax held across all 5 districts. So why does this poll show stronger support for healthcare tax than the national polls do? Was it the systematic way in which the poll focused on the problem rather than on the politics? Was it the manner in which the questions were asked, like trying not to ask leading questions like, gee, you don't want to pay a tax increase, do you, huh? The phrase tax increase does not accurately depict the important aspects of the publicly funded healthcare taxes that would typically reduce the cost. So the way we asked the question was different than the national polls have. Are Oregon voters different from national voters? Are Oregon voters more receptive to universal care than voters in other states? I don't know. Does the poll results show that voters would trust state government more than federal government to put together a universal care system? Could be any of these factors. Now, a little comment on what maybe could be wrong with the poll, that it got such higher support for universal care than any other poll that I'm aware of that was conducted in a legitimate whole state poll. Last November, I was asked to speak at a $60 a plate breakfast in Portland, and told they'd be bringing in another pollster to critique what Stuart Elway and I had done. Well, it turned out that the person that they selected was in fact a person who was a finalist to conduct the poll and who had been turned down. So he was in fact the rejected suitor, if you will. And I wasn't terribly worried because it's not good business for pollsters to really diss other pollsters. But I was really interested to what he would say. And he said something that I think was really, really good. He praised the poll, praised Stuart Elway as being one of the best in the business, noted that polling is very expensive, so something always gets left out. Well, he praised the meticulous manner in which the poll avoided any tendency toward partisanship. In his opinion, the partisanship is what is left out. He said, in the real world, people take sides, and this poll doesn't really address that since it's designed as a nonpartisan poll. To make his point, he asked rhetorically what would happen if I had put my measure on the ballot and Democratic Governor Kate Brown had endorsed it, then what would happen to the Republican support? And he didn't have to answer that. Everybody laughed. They understood that the Republican support would go away. The problem could just as easily be expressed the other way. How many Democrats would drop their support if a ballot measure were endorsed by Republicans or by large employers? And it was a little bit of his argument that this poll might be a measure of how much higher our combined support for universal care might be if we could just learn to get along with each other. So where does the support come from? It turns out it's highly age dependent in Oregon, and I expect in other places. There is virtually no net support above age 50, but even to get to 50-50, in other places like Colorado in 2016, seniors rejected their version of universal care like 90-10. So getting to 50-50 isn't bad, but age is very, very important. Support is majority support holds across all the income groups tracked, although it does decline somewhat with higher income. Although Democrats have tended to claim the issue of universal care as their own, there are actually more supporters of universal care outside the Democratic Party than in. How to achieve universal care? In the poll, those who believe that universal care is desirable were given a preference of how to achieve it, from the options of overhauling existing insurance, creating single public payment agency, or changing to public hospitals and clinics. Of those expressing a preference, the most common preference was to have one public payer, but that was not unanimous. One payer concept receives about the same level of support across all age groups. There were strong age differences in how voters feel about the other two options. Voters under 35 said they would actually prefer a system of public hospitals and clinics, more like the VA or England. 55 of the respondents in this poll described themselves as being business owners or otherwise self-employed. The remainder of this report compares their answers to specific questions to the other 347 poll respondents. Business owners and self-employed are likely to be a little older. They're just as likely to be male as they are to be female. The 50-50 gender split is not true in private employment where men tend to dominate, in public employment where women tend to dominate. Their income is more likely to be higher or lower. They tend toward the two extremes, and which shows this is not this is quite a varied group, and would include people who are part-time contract workers, as well as professional attorneys or other people whose income showed up as a business owner or self-employed. You might assume that they might be Republicans, but I don't know, because didn't occur to me to organize the data in a way that I could tell. Their healthcare coverage is very different. They are less likely to be covered by an employer policy, obviously, because some business owners and self-employed have low income. Almost 1 in 5 is on the Oregon Medicaid program. For a variety of reasons, business owners and self-employed are about twice as likely to be uninsured. How they rate our healthcare system: they have even greater dissatisfaction, both with the system as a whole. Only 42% said that they thought it was adequate, and they also expressed greater dissatisfaction with their own insurance. What did they identify with the problems? They had very similar responses about unequal access, medical bankruptcy, those kinds of social issues. And also they had similar concerns about keeping Medicare and Medicaid solvent. But they had even greater concerns about cost and complexity. Remember when I said 81% is about as unanimous as people get. Turns out business owners and self-employed are even more united that cost and complexity are major problems. When asked if they thought universal care is a desirable solution, a strong majority, although somewhat less than the others in the poll, strong majority is 64%, said that universal health care is a desirable solution to the problems. Now, in going back to getting back to the nitty-gritty of the two questions, the first kind of a general question: would you support a tax to fund a government universal care system? The response was almost as high as the rest of the population, 61%. But then when we tell them about the magnitude of the tax and give them the conditions that typical households would pay less than they do now, but employers would continue to pay about the same, business owners and self-employed dropped down to where they more people opposed it than supported it. And in fact, if you just look at the difference, and this is common statistical poll technique, is to look at difference between the answers of questions after you give them more detail. Compared with the rest of the poll respondents whose support only dropped by 1%, business and self-employed dropped by 17%, with about half of those going to undecided and half of them going from support to full opposition. As to why that was, you can surmise that perhaps when they're told that typical families will pay less, business and self-employed may not regard themselves as typical families. When you reassure them that business will continue to pay about the same, they may feel that they're being unfairly targeted with the cost. It's very interesting to look at the list to see which groups dropped in support. That's an indication of soft support when you give more details and groups begin to drop out. So why is, I mean, it's interesting to me that the two groups who dropped quite a lot are Democratic supporters and Republican supporters, whereas unaffiliated voters, when they heard the greater details, actually their support strengthened rather than went away. So in Elway's polls, he likes to ask open-ended questions. And this question is, why does healthcare cost so much more in the United States? And we got a whole laundry list of efforts. You can see there's at least 4 people in there from the numbers, at least 4 people who are doctors since med schools as blamed as the reason for the high cost. And Stewart compiled these, the leading causes, the leading reasons why people gave for the healthcare costing so much. Other people, including the core supporters of universal care, use words like profit, greed, and lots of other corruption, lots of other words like that. Business owners and self-employed tended to use words systematic, pointing to a systematic problem like waste or utilization. The others tended to blame insurance companies. Business owners do not blame insurance companies, maybe focused somewhat on government regulations. And it turns out pharmaceutical companies are not liked by anybody. There is a vocabulary problem between the word profit and the word profit. For others, profit is synonymous with greed. For business owners and self-employed, profit is synonymous with getting paid. Some quick observations. Politically, business owners and self-employed hit above their weight by being more likely to vote and by being seen as vital for economic health and employment. Business owners and self-employed are even more dissatisfied than the others about the current healthcare system, but they're maybe uncertain what to do. They're unlikely to form their own group, or haven't yet, to advocate for universal care, but they have not been quick to join progressive groups. The poll suggests that they're skeptical of progressive claims and they're turned off by progressive language. So here's some suggestions for addressing business owners and self-employed. Put on your centrist hat before striking up a conversation. Business owners and self-employed like to talk about solutions, but not about blame or personal complaints. Wrong button here. Don't tell them how business or healthcare economics works. Be open to the possibility that they may know more than you. Respect their needs and promise to fight for them. Make it about them, not about you. Ask them to describe the problems they see. Ask them what they would do to solve the problems. Stick to the single subject of universal care. There's no limit to the other things you won't agree on. Don't talk to them about paid sick leave. They pay it, but they don't get it. They don't get any of it, but they have to pay it. Don't be offended if they don't join you. They're waiting to see if you really intend to help them. And from a design standpoint, the big challenge of business versus progressives, both groups seem to support some form of universal care. Progressive trust government and detest insurance companies. Business trusts insurance companies and detests government. And if you want to see the details of any of the details of this poll, it's available at www.variedstrengths.com. So thank you, and be happy to respond to any questions or listen to comments.
Warren, you listed a lot of things not to say to business owners, like don't talk to them about getting the profits out of healthcare, because profits are what they live on to feed their families. Don't talk about shafting businesses and moving workers, because they're the businesses that employ workers. What could you suggest to put universal health care on the most positive spin possible when we're talking to small business owners?
Well, you do have to understand that it's somewhat varied group, and I'm addressing my comments maybe more toward the medium, at the bottom end, and the dog groomers and that category. You're going to find a lot of progressives. The people further up on the size scale are going to be really most susceptible. They're going to respond to discussion about cost and complexity. They're going to have quite a lot of sympathy with that based on the poll and based on having been one. They do have a lot of concerns, so they're extremely interested in the details, and they're unlikely to become universal care supporters until there is a specific plan where they know how much are they going to have to pay, how much are their employees, how is it going to affect their employees in a good or bad way. So they're very detail oriented, and many of them are in kind of a wait and see approach right now to see, show me the funding plan, show me the benefits, show me how my employees are going to come out equally as well as they are now. But cost and complexity are issues that span the whole political spectrum. Barbara?
Yeah, I love this aspect, and I appreciate your polling. Are you familiar at all with Businesses for Medicare for All? The
Yes.
group out of Pennsylvania? Yeah. But I think I mean, that's just an aside. But I wondered whether you were, and are they too progressive for your platform, or?
No, and in fact, I'm aware of them and I'm in regular contact with them, but my approach is a little bit different than their approach, and partly because being a Republican, I don't subscribe to the full progressive agenda, but to me, it's kind of an issue by issue thing, and I think. When I go to the Richard Master, Wendell Potter website, I see a lot of things. If you remember the slide that says some business people are going to be turned off by progressive rhetoric. And
visuals.
Yes.
But actually, the thing that I was thinking of, that I was reading a book by Steven Pinker, where he was reporting research of others about how people's ideas cluster, and how actually what they believe is more of a identification, that they identify with certain beliefs. And so I think when you said, who will they trust? Who will they like to hear from? And I've just been always trying to find spokespeople. I mean, spokespeople like you that would be more credible to someone who considers themselves a fiscal conservative, right? I mean, I wish we were more fiscally conservative, but and I identify as a progressive, but I just don't see fiscal conservative anywhere on the spectrum. But if there's somebody that they could identify with, would that be helpful?
Oh, I think absolutely, and that's one of the other things that came out of the breakfast where I spoke. And in fact, Sam was the moderator of that discussion in Portland. There was one of the most quoted political scientist people in Oregon said what's lacking, and this is apropos to what you just said about business, what is lacking is the kind of leaders that people identify with. He was making the point that we don't have that in Oregon generally, and we certainly don't have it. We certainly don't have it with business people. And in fact, business people are kind of, I think in general, kind of cast adrift by the current political climate. They may or may not appreciate the current occupant of the White House, but they are also very reluctant to support progressive agendas. So they're at a time where I think they're very open to seeing some kind of new leadership. But this is a kind of a time in our history where leaders, it's hard to provide good leadership that don't attract negative. So if you find one, let me know.
Well, that was what I'm asking, is that it would be, I mean, that's what I thought the Businesses for Medicare for All was going to try and develop people in all the congressional districts, to find people who could be spokespeople and, as you said, divorce it from the other issues. But anyway, I don't want to take everybody's time, but I just really appreciate what you said. And I'm still looking for those people. I really wish that I had someone that I could, that I could facilitate their presenting, right? Go out and beat the bushes for them and so forth. But I just don't have them.
And it is, as you say, we're probably looking, for whatever reason in these times, we're looking more for that social verification from others to say, yeah, we're right on. And that makes it harder. I think, what the polls showed is that if you take all those away, we'd have more supporters. If you took that element away, but that's not easily, since a lot of the firepower is really coming from people who are, kind of burning progressives. But one of the things that I had on a slide that I took off was just the very, to kind of be conscious when you're talking to business people that you might, if you support it because of your, as a matter of factional authentication, you are encouraging them to oppose it based on their factional authentication. And it's hard to not do that. I commend Mike Huntington, who's been out in the cow pastures with the grass seed farmers. I think the best thing that you can do is become a friend to people, and you'll be trusted over time.
Warren, your poll did not address this issue for obvious reasons, that you needed to keep your poll tight and bright and couldn't chase every squirrel up every tree. But something that most business owners are concerned with is their responsibility for picking the insurance for their employees, which in turn
your audio is garbled.
You should hear him in person. I couldn't hear all of that, Sam, but I think you were among other things pointing out the fact that businesses are likely to resent the fact that they have to put a lot of time and effort into choosing policies and doing administration. And if I'm a good lip reader, and I think that can be true. My own experience with a 500-person company is that we didn't really regard that as a big thing, but I think some people might. The kind of concern is, the amount of time that it took me was like about 1 week a year with insurance company representatives, but mostly we just hired people that we trusted and had a good relationship with, and they advised us, what the best thing to do for that year was, whether to up the, the amount of the deductible or whatever it is. None of us really liked it. We just assumed that we had to do it.
I had a question about, which Corinne put in the chat, basically, which was, there's a lot of information here that you've already distilled. Is there any way for us to go through this presentation again so that we can get that information to pass on?
There is a couple of things that I could do. I mean, one is I'm not going anywhere these days. So I'm happy to talk to people. The other is if you go to the website www.variedstrengths.com, and if you're asking would I post the slides, I could do that and have it up within a couple of days.
This is Rich.
That would be great. Thank you.
Warren, thanks for this information. Very helpful. I've got sort of part question and part idea for your reaction. Your poll is based on businesses owners would be paying about the same amount. Now, I think probably since your poll was done, there have been quite a few studies published on how to pay for improved Medicare for all. And I've read a few and talked to Gerald Friedman, who's one of those authors. And it seems that employer contributions in the various studies are more in the 8 to 10% of payroll range. The Lancet report says they use a default of 10%, having looked at some others. 8 to 10% is going to be quite a bit lower than a lot of employers are paying, especially medium or large companies that have a meaningful healthcare plan. So my question is, how much value would you see if those 22 studies were reviewed for the purpose of being able to show business owners some data? You were keen on the fact they want to see the details. And the data might go like this. There were 22 studies. 20 of them showed that we would pay less, both as a society and individually. And here are the various sources of public income that could be utilized. And typically business owners, majority of these studies say business owners would be paying, and I'm making this up again, in the 8 to 10% range. The point here is, again, when you're visiting with them, can you provide some data to ask them how would they prefer to see it funded? And by the way, here's some data from these 22 studies.
Well, if I may, and I've probably read at least half of those 22 studies, and particularly studies by Friedman and Poland, and by the Warren presidential campaign, and Rand study in Oregon, and I read them all pretty carefully. And this is one of the points where I disagree with Richard Master. In his videos, he talks about, his payroll cost, or the percentage of his healthcare is about over 20% of his payroll cost. And wouldn't it be something if he could get down to 8%? Well, the reality is, when you look at those studies and the most credible ones, of course, none of them are credible until Congressional Budget Office writes one. They're talking about, maybe up to a 20% savings on some kinds of policies, but Medicare and Medicaid are not really going to go down. So an average, when you take the whole population, maybe you're going to save 10%, maybe all the way up to 15%, but your costs are going to go up about 10% because you're going to be covering people who are uninsured or underinsured now. So the net savings is going to be about 5%. So when you've got people thinking that they're going to save half their cost, it's only because someone else is going to pick up the cost. So like I say, when, I've disagreed with Richard Masters saying that he's in favor of it because his costs are going to drop from 22% to 8% under the Gerald Friedman plan. I'm saying everybody who's paying is going to need to shoulder like about 95% of the same amount that they're paying now. Otherwise we're going to have too many winners and losers, and we're going to have strong opposition. That's my opinion. I do greatly respect the efforts of all the people who have tried to put funding plans together, because I think that's something that we've really been short on. Barbara, did you have something?
Yeah, I wondered if there was a business analysis of the, the value of insurance companies, what they add to the process of providing the medical care, so that if there was some way for business people to evaluate this other business that, by the way, this last couple of years has been making 5 and 6 times as much profit as other sectors of the economy. Do the business owners tend to admire that, or do they think it's kind of not such good business practice? I don't know.
Well, first, I've seen the numbers that you just quoted, and I disagree with them. I think insurance companies in general don't tend to be, and particularly medical insurance companies, haven't been good investments. For some reason, their stocks have been running up over the last few years. And so a lot of the statistics about, boy, aren't these great profitable companies, is based on their stock price, not on actually on their return on investment. When I look at insurance companies myself, and this is using the national expenditure accounts used by Kaiser Family Foundation, when you hear people talk about insurance companies, you'd think, my goodness, their percentage of the cut of insurance cost is just going off the map. But in fact, it's been flatlined for about 70 years. They've consistently been at about 12%. The net cost of insurance has been, it fluctuates depending on good years and bad years, but it hasn't changed in 70 years. So they're not suddenly walking away with a huge cut of the pie. They're getting the same cut as they always have. So that's the big thing is, and not to say that they're not contributing to the inefficiency, but I think most businesses would say what's wrong here is you've got an unhealthy game going on between insurance companies and hospitals and medical providers that's creating waste. So they see, I think, the opportunity to that. But you also understand that, and in this poll, something I don't know, but odds are that a certain number of people, of these 55 people, there's got to be an insurance agent or two in there.
Well, health insurance, probably not. I mean, you might not have wanted one.
Well, I actually asked the question of the people in the poll, are you, do you work in the health care or health insurance industry? Interestingly enough, the people who said they didn't answer the questions a whole lot differently.
Hmm.
But a point I wanted to make is that business and self-employed are because they tend to buy their own insurance or buy insurance for their employers. They have a long time trusting relationship with insurance companies. They've worked with insurance companies to say, how are we going to try to hold costs? So insurance companies to them are the hero. They're the ones who've been fighting back against the outrageous billing of hospitals and providers. And so they're more likely, I mean, business owners and self-employed are more likely to say, these are the heroes that have been trying to hold the cost for us. They're not likely to see them as the villain. And I'm saying, you know, I'm speaking in a general way and also from myself and other business owners, but I think that's what the poll says too. Corinne, you've had your hand up a bit. Could you unmute?
You're muted. You're
Just
muted.
it's giving us such a how do I unmute.
No, you're unmuted.
Okay, now I'm
You're fine.
on. Thank you. Your presentation is marvelous. It's just giving such a good perspective on the thinking of people that I think differently from, but it's so objective and just really useful. So I appreciate it. I missed the first few minutes because I was trying to get on. I don't know if you answered this, but you're obviously interested in this issue. And what made you get involved in this issue, and how do you feel about it yourself?
Well, I'm trying to think of I have longer answers to that, but I'll give the shorter one. Is part of the reason why I'm interested in it is, you know, some people worry about the 1%ers. I don't think about the 1%ers hardly at all. I'm not one, and I do have some sympathy of what their problems are. But the thing that really concerns me when I started following statistics is 1986, the bottom 40% in the United States had about a little over 9% of the total income. In 2017, the bottom 40% had 5 3/4%. The bottom, let me repeat that, the bottom 40% had 5 3/4% of the income. Now that creates a world where, you know, and I've been fighting this battle for 30 years, didn't see anybody standing in line with me paying $60 for the last pair of Levi's from a plant in Texas when they could get $22 Levi's from Bangladesh or other places. You know, I've been fighting this battle of trying to save the lower middle class for a long time. And I think that's where the real trouble is. And the things that are happening to them, I don't blame on the top 1%ers. I blame on a whole lot of things that are going on in society that Mike Huntington would tell you about. I mean, they're kind of systemic things. But the real problem is, what are we going to do for those people? So in the United States, when you look at our charitable contributions, you say, I mean, it's easy for people to say, oh, when you add up food, clothing, and shelter, you know, we're kind of miserly in the United States, and we don't help people as much as some other socialist countries. But when you add healthcare, and the fact that we're paying double for healthcare what anybody else is, we're paying more charitable contribution than any other country in the world, partly because we have more people in poverty. But you can't, there comes a limit of charitable leverage where, I mean, you know, like in 1950, 98 people could take care of 2 people who couldn't pay their own medical bills. And in, let's say, 1965, maybe 92% of the people could take care of 8% of the people. But if you see what that teeter-totter is doing, it's getting further and further. And we've gotten to the point where my belief is that we're approaching the sinking point of the Titanic, where the water is flowing over from the fourth bulkhead into the sixth compartment. And we have to figure out a way to take care of these people. We can't take care of them at a high cost. We have to reduce the cost of healthcare to a point where, I mean, it's, the Kaiser Family Foundation says that 33% of people cannot pay for their health care. So that means that the rest of the 2/3 have to pay 50% extra for their health care. That's the way it works out mathematically. So it's suicidal to our national health and national competitiveness to not all of us work as hard as we can to say, what can we do that is humanely responsible and financially possible? So I'm sorry, I kind of spilled over into the long version there, but.
That's fine. Can I add, sorry, Michael, I wanted to ask one other thing. Do you believe a one-tier system where everyone has equal access to care is beneficial in line of what you just discussed?
Yes, I think it's workable. I mean, if you asked me my own personal opinion, I believe that the only thing that can defeat the fee-for-service paradigm is going all the way to publicly funded, publicly provided. And I think, the school systems work great as far as I'm concerned. We don't have school teachers trying to keep track of how much time they spend with each student and sending a bill based on every interaction. By going completely to the full public model, I think that's where we have to go. I think one-payer states, the idea of a single payer is an improvement. But if you ask me personally what I favor, I think we have to go all the way to publicly provided. And how we get there, I think, is kind of inevitable, but I think we have to be working in that direction. Michael?
Yeah, I just want to make a plug for next week to help answer some of Corinne's questions about the role of the insurance companies. It's not that they're making tremendous profits. In fact, at selling indemnity insurance, in fact, they're getting out of that business. They're investing in healthcare delivery. Half of the insurance that employees get now is through self-insured plans. And in those cases, even though the employers trust the insurance companies, they have no way of finding out how that money is being spent because it's proprietary information. Actually, it's not the insurance company taking the risk anymore, according to Dr. Belk. It is the secondary insurer like Aetna, who's just doing the bill processing for a company that takes no risk, but can charge as high a premium as they want and encourage hospitals to place their charges high because both gain in that process. So I don't show those CEOs with their millions of dollars. Warren has told me not to do that. Besides, that's only a small percentage of the cost. It's more of a symptom of the illness. And the illness is something that Dr. Belk will describe next week, sometime during this time hour between 5 and 8. So hope you can come.
Good. Will you send us more information about when it is and all of that?
Yeah.
Good. Thank you.
You have a question?
Yes. Mike, let me know if we're supposed to be finished right now, or if there's time for another couple questions?
I'm still here.
Okay. Warren, you mentioned earlier folks need to avoid coming off sounding like the full progressive Bernie supporter. Having said that, is it fair to say that business people do recognize that the current funding mechanism is highly, highly regressive and it needs to change in the progressive direction? And if that's maybe a prefacing comment, the discussions with some of the more senior business folks in the Denver area has pointed out a certain dilemma. One is that while they may become comfortable with certain more details presented, that their company could save a meaningful amount of money, you're a little more skeptical about that. In order for the companies, the employer, to be paying a smaller percentage, then the revenue needs to be generated from other sources of public income, which tends to look at then financial transactions, how capital gains are taxed, etc. So you have those making 400 to 500,000 plus, and there's some making a lot more than that, but that's that 5 to 10% that are going to pay more in most of these studies versus the 80 to 90% of the folks will pay less. So when they're looking at their company and saying, my company could pay less, but as an individual, I'm going to probably pay more. How do you see that playing out in their heads?
Well, I think that's a good comment because I think they'll be doing the math on that pretty quickly, and I'm not sure there's a perfect answer to that. You know, when you talk about other revenue sources, that's a thing that I get concerned about because some of these other plans, including Gerald Friedman, is based on heavy tax on capital gains, and also Robert Poland the same. He's suggesting, and you know, his plan is pretty close to Bernie Sanders, and when you really look at their plans, they brag about how they're going to have an extra wealth tax and how they're going to have, up the capital gains tax. But when you look at their whole plan, that only raises 5 or 6%. The rest of it is all going to the regular citizens. And in fact, Bernie Sanders' plan, I think, would have shocked everybody if people had understood that it's getting rid of significant amount of funding is coming from getting rid of the tax preference on employer-paid benefits. And who is going to pay that tax? Well, it's going to be union people. It's going to be, it's going to be a whole lot of people who are being told that the taxes are going to be on wealthy. But to me, it's not. It's only slightly different as far as regressive payment system that we have today. But I wanted to make the point that you need to find a stable funding source, and having written a design guide for universal care funding in Oregon, we've looked at a lot of those things, and in the Great Recession from 2007 to like 2015, you look at whose income dropped. Well, if you want to put a big tax on the 1%ers, if you want to put a big tax on the capital gains, their income dropped. I mean, capital gains in Oregon and the rest of the nation dropped by 74%. You can't fund something based on a revenue source that fluctuates that much. So we're lacking sane stability in some of those plans. and the 1%ers lost 30% of their income. The regular wage earners, wages as a revenue source only went down 4%. So, I mean,
Where does that leave? What's your conclusion? Are we keeping the same level of burden, so to speak, on employer and employee and not looking for other sources?
My conclusion, and if you, I really recommend a book by T.R. Reid. T.R. Reid's famous for the Sick Around the World, but he wrote another book about the American taxation system called, I think it's called A Fine Mess. Yeah, there, Mike is displaying the book cover. T.R. Reid strongly recommends what he calls a bubbler principle, broad-based, low rate. So, the kind of thing based on his recommendation, the kind of thing that I would suggest is you tax everybody's income the same. Doesn't make any difference whether it's from wages or from business profit or from capital gains or everything. One rate, hardly any exceptions. You have to make adjustment based on how many people are in your household, and then that's the healthcare premium that you pay is based on income, and that in that way it becomes less employer-centric and more taxpayer-centric. The problem with things like Social Security is that it's based on employment. It's based on the concept of earned income. Well, that's great, but the people who are self-employed, they can play that game. Suddenly they're, they may make $1 million from their business, but only they pay themselves $20,000 wage. And then the rest of it comes into them in the form of royalties and renting the equipment to themselves. So, I mean, I really think that what we have now is unfair to employees. And I think that the right thing to do is to get rid of the employer-centric model altogether. I mean, you can still have employers contributing in the name of their employees, but charge everybody the same. Don't have 5 different kinds of income that you charge different rates on. That's my thought, and maybe not. I think as a principle, I think the bubbler, broad-based, low rate, and few exceptions, and there's no difference between your source of income.
And no tax deductions for charitable donations?
That's fine on your regular taxes, but if you're going to have equality, you've just got to have it based on saying, well, what's your household income? That is something that makes it all difficult, by the way, is that the federal standards of affordability are all based on household income. So trying to convert our income tax system to collect money based on household income rather than, employment, payroll taxes are based on individual income. So some of that gets a little bit harder. You just have, but some things I have to believe that there's a way to do it. So anyway, that's my thoughts on how to share that burden. And I think it's also fair to say that almost anything that we do, we're going to see something more progressive than we have now. That's inevitable because of the 40%. The bottom 40%ers, I say like, gee, that's a really small number. There's only 40% of them who are in this pickle. But we really need to have something that is a more progressive schedule than it is now. It won't be tremendously progressive because you have to remember that that the 99%ers, let's call them, still have about 85% of the after-tax income. We can't run away from our responsibility. We can't just lay it on the 1%ers. Yeah, Jerry, could you unmute yourself? Or
am I unmuted now?
Yeah.
Can you hear me? So we've been talking about funding a single payer healthcare system more, in the recent past few weeks. What we've experienced is, millions of people who have lost their jobs and therefore lost their health insurance. How much of an argument would that be to discuss with business owners? How important is that?
Well, I think, speaking as a business owner, I think you can't run away from the problem that, assuming that you have to fund the program, you're going to rely on the economy to fund it. And, in the case of, what's happened with the COVID thing, it would be really nice from an administrative standpoint if people who lost their jobs wouldn't also lose their health insurance. And that's from the patient side. From the funding side, you have to consider, what are we going to do? If business income goes down 50%, how do we, and individual income goes down, how do we pay for it? It is an argument that some people have made that it is why state systems won't work as well, because states can't run deficits. The federal government, for better or for worse, can write big checks to try to tide you through a bad period of time. And without arguing whether that's good fiscal responsibility, I would say that there isn't really any funding source other than as broad as we can get it that will help to get through the recessionary periods. Did I really did I do justice to you there, Jerry, or do you have? Okay, thanks.
I'm going to have to run. Thank you.
One more for you, Warren. I really appreciate your reminder. I have read T.R. Reid's book, but I appreciated the reminder. Broad-based low rate, and I'm restating to make sure I heard you, that on a new tax for healthcare, broad-based low rate would be on all household income, basically gross income, and whatever happens to the rest of the tax system where there's still multiple deductions and whatever gaming goes on or benefit, such as deductions for philanthropy, et cetera. We're not messing with that or trying to. It's just for the healthcare equation, keep it simple, broad-based, low rate.
Yep.
Did I hear that? Now, here's a glitch that we found in Colorado on our ill-fated effort a few years ago. And it was one of the best lessons we learned about what we didn't know. And this is getting into the weeds a bit, but it became a big deal. 70% of the small business owners, and this is a very casual survey of accountants, 70% of true small business owners would probably have come out better with the Colorado formula. But 30% of those who had pass-through income that was significant pass-through income, the LLCs, sub-S corporations, sole proprietors, for many of them, they see a huge amount of income on their tax statement, but they don't see the cash going into their personal bank account because it stays in the company to be reinvested. So when we started talking about a tax rate on their income, some of those were going to view it as highly punitive. How would you treat pass-through income that stays in the company for reinvestment or for cash flow purposes?
Well, that's a little bit of a controversial subject because, among other things, it involves corporations. And how I would treat corporations it isn't pure science. I mean, as a basic principle, profit from corporations, either in terms of growth or in dividends, eventually flows to the individuals. So it will eventually get taxed. Corporations can defer tax, they can't avoid it. But you have to look at who the winners and losers are. So there are, when you look at the way that Social Security was set up, it was kind of decided that there was a certain class of people who needed Social Security, kind of a forced savings program. And so it was only, the tax was only applied to earned, quote, earned income. It doesn't include income from rent or business or things like that. So the kind of concept that I think I would promote is that some people who now aren't paying because healthcare in a way is designed around that same concept of we're trying to take care of a certain class of people. So to a business owner, and of course it depends on, you know, how many employees you got, how much profit do you have. For most of them, it shouldn't make much effect, but for some of them, it really would make an effect. I mean, if they're paying, say, you know, $20,000 a year for their health insurance, but suddenly they've got to start paying a 15% tax on $1 million, that's going to be different to them. And it's something that I think really needs to be addressed. I don't want them to get off scot-free because I don't think we can survive without them putting in their quote, you know, kind of similar percentage. But I think one of the things that you have to address is having some kind of cap, so that nobody has to pay more than a certain amount, like $50,000 a year or something. And an idea that's been suggested in Oregon is actually to cap the tax at some amount. Different amounts have been suggested, 50,000, 75,000, 100,000. But above that level, it would be what you could describe as a soft cap. Maybe they don't have to pay, you know, like 15% anymore, but they still have to pay 3% or something like that, all the way up to 40 gazillion. But they're not. It's not going to be so big that it's going to ensure that they spend every penny they can to defeat you. That's kind of the idea of it.
Mm-hmm. Thank you.
What did you think about Elizabeth Warren's 2 cents on everything over 50 million?
Well, I'm intrigued, and I think the idea of wealth taxes is overdue. But I think there are kind of problems with wealth taxes in general, and I don't want to spend a lot of time on this. But I think wealth taxes have a high overhead to collect. I mean, if you're having to go out, have someone assess the value of a private company or an art collection, or, I mean, it just gets to be pretty impractical. But still, I think there's ways you can get a little bit of money in wealth taxes that would make everybody feel a lot better.
Thank you.
Well, thanks, Warren, Barbara, Corinne, Rich, Dessa. This is wonderful.
Thanks.
I did record this, and I don't know if Warren is okay with us sharing the recording.
Maybe I should look at it first.
Okay, you get first look.
Thank you very much.
Thank you. Bye-bye now.
Very
Thank you, everybody.
Thanks, Warren. Thanks, Mike.
Bye. Okay.